Doctors of Reddit, have you ever had to fire a patient? If so, what was the straw that broke the camel's back? Story 1. When I was a paramedic, a call came in that a child was suffering from a severe peanut allergy. She was 7, and her older brother thought it would be funny to force feed her peanut butter. Either way, get her loaded in, but the mom is just dragging her feet. She forgets her purse, then her phone, then her brush, then her gum or whatever. I just sort of waved at her. Hi, we need to go to the hospital now. Child, sick, hospital, let's freaking go. So she waddles her way out over to the ambulance and gets in. It took about 3 minutes before her phone was out and she was snapping pictures of her daughter for her Facebook page. One of those like to make my baby better things. So once again, I just sort of wave at her. Hi, please stop. We're trying to help your daughter. She ignores me. More Facebook or Twitter pictures. Click, 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 click. I just lost it. Stop taking freaking pictures, you dumb freaking chunt. Then I took her phone away. So now mom is flipping out because I took her phone away. We get to the hospital and mom is still flipping out over her phone being confiscated. People at the hospital think she's distraught over her child and try to calm her down. They figure out it's about her phone being taken away by the mean man in the ambulance. Click, 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 like to save my baby. Click, click, click. Then I hear the attending MD just explode. Okay, get the frick out. Just get the frick out of this room. I guess that would count as being fired. Wow, I came back to this? Well, at least most of the comments are civil. Yes, I did get in trouble. To the poster person who thinks that I would be fired immediately, you've obviously never worked in any medical fields, which is sad. I got what was called a note to file, or semi-final. I'm sure the term is different for different places. What that means was I had to sit down and speak with my supervisors regarding the incident, but that was because I took her phone, not because I called her a chunt. Yes, doctors can ask people to leave if they're being disruptive, and they're trying to do their job. Yes, they can say get the frick out, especially if someone's life is at risk. Okay, I'm working. Bye. I feel like this would justify calling CPS. Reckless endangerment of a child? Neglect? Being a slowpoke with a camera phone? Story 2. I've fired a number of patients, and likewise been fired. Sometimes it just doesn't work out. For one of my colleagues, the last straw was having the patient break the exam room wall with her head and then leave screaming obscenities at her. I actually chased that one out myself. Falling glass on the other side of the wall almost hit my own patient. First patient I ever fired myself tried to destroy her own medical records. A wise doctor I knew early in my training once said, "The only things I'll fire a patient for are physically abusing me, abusing my staff in any way, or calling me at home." Seems about right. I sort of thought that was the way all doctors were, at least the ones I've known. I was surprised last year when a doc and patient made our paper after he fired her for not following his recommendations. I think he had told her to lose weight and take some tests she didn't feel were necessary. She was a nurse and filed a complaint against him afterward. I'm sure there was more to it than the blurb in the paper, but it all seemed odd. If I fired everyone who rejected my advice, I'd have nobody to see. But sometimes it's clear the patient isn't accepting anything offered and isn't interested in working with you. Then it's probably best to help them find someone else. That same doctor sometimes would say, "All I can do is give you medicine, do surgery on you, irradiate you, give you psychotherapy, or give you lifestyle advice. Those are the only tools I have. You've rejected all of those, so I don't think there's anything I can do to help you at this point." They'd usually go away, and sometimes come back, having reconsidered what they were really looking for. Smart guy. Story 3. Once a year, my mother sits down with her big list of area pharmacies and calls them all. She usually finds out a few people are doctor shopping, and one time she actually discovered someone had been altering and forging her prescriptions. She writes these people a letter to formally fire them. For those of you curious or skeptical about this, she works in a rural clinic and there are about 20 area pharmacies tops. She doesn't have hundreds of patients, nor are there a ton of places to fill a prescription. She also doesn't ask about every single patient, just a handful of ones who are on pain meds. My mother would never be able to operate a database or keep an Excel sheet. She's a bit of a Luddite. It's a phone book, pen, and paper for her. It doesn't take as long as you'd think. She's on the phone for maybe 10 minutes per pharmacy, and she usually does the whole thing on a Saturday afternoon. I agree it's not efficient, but my mother is a rural, solo family practice doctor, and things work a little differently than they might in a suburban or high-volume practice. Prescription drug abuse is a huge problem in her practice, and she's gotten burned enough that she decided to find some sort of solution. It works for her. How does this actually work? Does she ask what patients of hers they have? Does she read off the names of the patients on pain pills and see if they have any prescriptions in for them from a different doc? There's generally a finite number of people who will come to a pharmacy with scripts for Class 2 narcotics, usually only a couple dozen, so calling around to check is probably not too time-consuming, and the other doctors probably appreciate that this person is looking out for them. Story 4. Not the doctor, but I am the girl that writes the "you're fired" letters to the patients. In 4.5 years, I've written something like 40 or 50 letters. Most are people on narcotics that have come up positive for other drugs multiple times. My doc is nice and likes to give people second, third chances. Other times, it's for doctor shopping or seeing multiple doctors for the same issue. Some are for multiple no-shows or cancellations. Most recently had 64 cancellations in 3 years. The rest are due to bad behaviors. One was calling the doctor and practitioners horrible names in the waiting room to other patients. Another screamed at everyone in the facility because she had a history of filling meds early and we refused to give them to her early anymore. Another kicked out our glass door because we wouldn't give her narcotics. She wasn't even prescribed them. Another called over 25 times in one day, just straight up harassing us because we wouldn't help her commit fraud. There's lots more. These days, though, we don't have to write letters most of the time. They get blocked due to non-payment of their bills. Once they're blocked, they can't make appointments. And without appointments, they got no meds. So suffice to say, this has caused a lot of drama lately. What do you mean when you say doctor shopping? I ask because it's always a nightmare to get my prescriptions filled, and I usually have to call multiple times. So is my doc going to fire me if she finds out I'm looking for a different doctor? I'm already worried she'll fire me for having a crappy RX company that forces me to badger her office for refills. Doctor shopping is a bad term. It doesn't mean looking for a different doctor to transfer your care to. It means going to a bunch of different doctors at the same time to get multiple medication prescriptions, usually narcotics and or anti-anxiety meds. Generally, this is considered a sign of narcotic abuse or diversion, but occasionally it's a result of undertreated chronic pain. Story 5. I was the one that got fired. Long story, but I was having problems for about 6 months and was sent to the neurologist in my small town. When I got there, the doctor didn't have any of my files and straight up told me so. I told him what was going on, and he prescribed me 3 separate pills for headaches, insomnia, and nausea. Well, I researched these pills before I picked them up and decided not to take them. It would have masked my symptoms, and I thought I wouldn't get a diagnosis. I saw him after another MRI and told him I didn't get the pills he prescribed. He told me I needed to leave because he wasn't going to give me oxytocin. I tried to tell him that's not what's going on. I just wanted to know what was wrong with me, but he had no cares to give. 3 months later, I was diagnosed with a somewhat rare malformation and large cyst in my brain. I have neurosurgery in November. We plan to sue the doctor for malpractice, but I'm waiting until after recovery to talk to a lawyer. Talk to a lawyer now. You don't have to file until you're feeling up to it, but best to get the ball rolling. I don't think you understand what malpractice is. I very much doubt even the slimiest plaintiff's attorney would take your case. Story 6. I was the fired patient. Well, I sort of quit anyway. I had quite a bad dentist at 13 who would just not listen to what I had to say. One time I had a cavity on one of my molars, asked for an anesthetic like I always did for years with all my previous doctors. My pain tolerance is low when it comes to teeth. She didn't want to give me an injection, but I insisted, and she finally gave me a dose that was way too small. And instead of waiting the usual 10 minutes for it to kick in, she started drilling immediately. Of course, I screamed in pain and nearly stabbed myself with the drill because I got so startled. She yelled at me for being a baby and said I'm exaggerating. It doesn't hurt at all. I got defensive and asked her if we could wait until the anesthetic made it numb, but she didn't want any of it. I laid back on the chair and reluctantly agreed to go on. But as soon as the drill touched the tooth, I wanted her to stop because it hurt like hell. She just told me to stop whining. Then I screamed bloody murder for her to stop again. When the instrument was out of my mouth, I stood up. "Can you freaking hear me? I told you it really hurts." She got super offended, but I didn't let her speak and told her to just give me a temporary filling and I'll be getting a new dentist who cares about their patients. A few days later, I wrote her a letter of apology because my mom wanted me to. I admitted that I overreacted, but I let her know that patients are people to be considered, not ignored when they're screaming in pain. Surgery, yes. Story 7. Dentist. After spending multiple appointments explaining concerns with healing after an extraction, she continued to be argumentative and then said, "You Arabs are so stubborn." I told her she can be a racist out on the street, but not in my office, so please leave. As a side note, I'm Iranian and I practice in Canada. I came here when I was 9. "No, man, no. Your skin looks different than mine. You are clearly a terrorist." I've met a couple of Iranians who were very quick to say we're not Arabs. And then my Arab friends would be like, "Yeah, right. What's the whole deal?" Never understood it. Since some folks below seem to think I'm being racist, I'm going to rephrase. Rereading my comment, I do see that its undertones could be misconstrued as being racist, but please, before y'all get judgy-like, you want to remember that the written word and the spoken word can convey two different things. As I mentioned to the person way down below who thought I couldn't even be racist right, that I have close friends from different religions and ethnicities. I friggin' love them. I'm not racist, okay? It blows up because I type sentences quickly from the phone without thinking it out. I am a non-white chick myself and know what it's like to have stereotypes and whatnot projected on me. Story 8. Dentist. One time I refused to see a patient after they refused to stop chewing gum. I mean, during the appointment. I asked her 3 times, and every time she pretended to take her gum out, which at 16 years old seemed pretty childish. I finally worked on her, and as I took my hands out of her mouth for an instrument, she started chewing again. It was still in there. I told the parent that their daughter was not ready for braces. They argued, but she would not follow the simplest instructions, let alone habits she would need to form to keep her teeth clean throughout treatment. She sounds incredibly stupid. What really got me was the mother aggressively defending her. This isn't an opinion. Your daughter will not follow directions. She was chewing gum through the entire consultation. It's still in her mouth right now. Story 9. My dentist was fixing a cavity of mine once. She said that when she was a resident, she had a patient who told her that, "When I, the patient, tell you to stop, you need to stop right away, or I'll punch you in the mouth." They both had a good laugh over that. Then the patient told the doctor, "No, I'm serious." The attending told my dentist to finish up with the patient and then tell the patient to never come back. I had gingivitis when I was a kid, and the assistant at my dentist used to stab my gums when she was cleaning, to the point where I thought it was deliberate. I kept saying ow, and she kept telling me not to be such a baby in a super witchy way. It's entirely possible your dentist was like that and you just weren't getting the full story. Or they trot out the, "If you flossed more, your gums wouldn't be bleeding." No, witch, if you stop stabbing me in the gums with a metal pick, they'll stop bleeding. Story 10. I have fired 2 patients in my career. The first was a family of a man about to have a planned surgery. They were upset that they had to wait until the following week to see the cardiologist, and because of their influence, they called their state representative. He called the hospital CEO, who called me. I explained the situation. I then called the patient and told him that trying to force the system to work solely to his advantage was not how this was going to work. I explained that the doctor-patient relationship in non-life-threatening situations is voluntary and gave him a list of other specialists in our area. The second had a wife who was very mean to my staff over several visits. In their last visit, she made my lead nurse cry and actually hit one of the techs as she was helping the patient put a sock back on. The patient made no apology for her, supported her actions, and seemed to think that this was normal behavior. Oh, that first guy, what a bunch of selfish pricks. But he was a special case, though. I mean, he really wanted to get treatment immediately. Immediately! Yes, right now! Which makes him more specialer than all the rest of the patients. Story 11. I was dumped by my first OBGYN. After I had my daughter, I needed to research my birth control options because I still got pregnant on the pill. He gave me the depot shot without my permission, like they told me it was something else. So my next appointment, I got the nurse practitioner and doctor, and I was like, I was interested in this. And she goes, oh no, you got the shot. And I was like, no, I said I didn't want that. I don't want the depot. It will mess with me. She looks at the chart and sees my consent was never signed, and the doctor tells me I need to sign it, and I refuse. I was ticked off, but I was 17. I didn't know just how bad I had been screwed over. My next appointment was just him, and he basically told me to find a new OBGYN. Looking back, I would have pitched a huge fit, but being young, I didn't know any better. This is actually a pretty big deal. He dumped you because he was worried about you suing him for malpractice. You probably would have won if you had. What the frick? That's so messed up. You probably needed a new OBGYN anyways. Screw that. Story 12. I'm a nurse practitioner. In my area, and because we are in urgent care, we get a lot of doctor shoppers. But in California, we can look up the narcotics record, so at least once a day we will tell the patient that it seems like they're fully stocked from another doctor, and that they're not going to get any more. Usually they will be resigned, but sometimes they will get super defensive. There's a mother and son that stole the main doc's DEA number and called in poorly worded narcotics on an elderly person. We fired them and turned them in to the police. I once got a pharmacy call that started with, "Doc, I know you didn't write this, but I had to check before I called the cops." A patient had stolen a script and wrote 1 pound of morphine, 10 refills. "Doc, I know you didn't write this, but I had to check before I called the cops." That's 2 lines of almost perfect blank verse. Story 13. I'm a specialist. There are only a few things that will get a patient fired. Verbally abusive with my staff. I have zero tolerance for this one. A patient can get mad at me and yell at me all day long. I can take it. My staff is different. They don't get paid to be abused. Period. I will always stand up for my staff. Chronic no call, no show. 3 in 1 year and you're out. I have a 3-month wait list. I will keep my spots for patients who want to come. Other than that, there are patients where we mutually agree to disagree and we part ways amicably. As someone who used to be a secretary in a doctor's office, I know your staff fully appreciates this, even if they don't say so. After working there 3 years, I left that office and never looked back after being verbally abused almost daily by patients and having the doctor shrug it off like it was no big deal. Thank you. For me, it is a big deal. Sorry you had a bad experience. Story 14. Not a doctor, but I work at a pharmacy, and we got a guy thrown out of 2 practices. He was doctor shopping and getting oxycodone prescriptions from both. You would think he'd be smart enough to go to different pharmacies to fill them. I always worry about this myself because I got multiple opioid and controlled prescriptions from multiple doctors sometimes, like morphine, Dilaudid, Oxy, Valium, although I actually need it for things like acute post-op pain and open wounds that I have. We have the iStop electronic script tracking program in New York, but it still just seems like the pharmacist fills things at their own discretion. I had the theory that he just mixed up the pharmacies and meant to take this one to the other pharmacy he was using. Story 15. I'm a psychiatrist. Meth. Always meth. Don't use it and then come to me with psychosis and tell me you're bipolar schizophrenic. It may work on some, and in a field where a lot of care is done by less trained social workers, it's common. But I went through far too much school and hard work to be fooled that easily. Sorry for the stupid question, but do people do meth and try to get prescription drugs, or what? Story 16. I was asked by my psychiatrist how I was, and I told her I didn't want to be there. I was less than 14 years old, just telling the truth. Anywho, she told me to leave, and she talked to my parents. That was the last I saw her. If that was their response to that kind of statement, they were not cut out for the job. Maybe it was the last straw on a bad day, but wow. It's altogether possible that speaking with the parents solved the issue or let them decide therapy wasn't needed, or wouldn't be needed unless something continued or happened. You don't have enough info to make that call, not by a long shot. Story 17. Drug addict who basically refused to try to change anything, was on RX narcotics and benzos, then one day ended up in the ER. The drug screen in the ER showed no benzos or narcs, which confirmed my suspicions she was selling them. In retrospect, everything she was on had some street value, including her antidepressants. People will use anything here, snorting Wellbutrin, etc. Snorting Wellbutrin? Maybe in prison? Yikes. I was about to say, nobody snorts Wellbutrin, but I have seen dumber stuff before. I believe you. Story 18. I work in administration at a surgery center, but we wouldn't even look at one patient after he threw a chair at me when I told him how much he had to pay our facility. Well, it's not always easy to refrain from throwing furniture at you guys. I always start with an accessory, like a throw cushion, and work my way up to a Queen Anne chair. Please leave your stories in the comments. I'd love to make a video of them in the future. Also, don't forget to like and subscribe.